Hello, this is Richard Gallion, BSM, MA, Master's Degree, PHN, Director of Nursing. Today I am speaking for Voyager Home Healthcare, going over our restraint training section, number 10. The definition of restraint. Restraint means a physical, mechanical, or chemical restraint that immobilizes or reduces the ability of the patient to move his or her arms, legs, head, or body freely. Methods typically used for medical surgical care shall not be considered restraints. Some of these certain methods that aren't considered restraints are the use of bandages or prescribed devices, the use of required devices to limit mobility during a medical procedure, or the use of a drug when it's part of a standard treatment or dosage for the patient's condition. For the purposes of this definition, physical restraints used for all fall preventions, including but not limited to raised bed rails, shall not be considered methods typically used for medical surgical care. Voyager does not use restraints in general. So at Voyager, we have a no restraint policy. However, the Director of Nursing may allow restraint use if demanded by a physician in an emergency situation when care providers are trained. This training is for education emergency situations only. So though even we have a no restraint policy, if a medical doctor demands under the situation, it can be allowed by the Director of Nursing, but this would be a very rare situation if it would ever occur at all. Patients have the right to be free of the inappropriate use of restraints. Inappropriate use includes improper applications of restraint or the usage of restraint as means of coercion, discipline, convenience, or retaliation by staff. Voyager, once again, does not use restraints in general. However, the Director of Nursing may allow restraint use if demanded by a physician in an emergency situation when care providers are trained. Voyager trains our care providers on ongoing individual patient assessment to determine when a medical condition or symptoms indicate use of restraint to protect the patient or others from harm, the least restrictive intervention, and the discontinuation of the intervention at the earliest possible time. So once again, Voyager does not use restraints, but we are going to have restraint training, just so you know, for your own educational purposes and if there is ever an emergency situation, which would be very rare. More definitions. Chemical restraints means giving an individual medication involuntarily for the purpose of restraining that individual, except that chemical restraint does not include the involuntary administration of medications. So chemical restraints are when medications are used just for the purpose of restraining an individual. Now, there's a lot of chemicals that do put patients to sleep with sedative factors or paralyzing agents, and those wouldn't be considered a restraint if they're used for medical purposes, but if they're used just to restrain the client and that's the only use, then it would be considered a restraint. And Voyager will never use chemical restraints. Emergency is another situation, and it means serious, probable, imminent threat of bodily harm to self or others where there's a present ability to affect such bodily harms. So we're speaking about the emergency use of restraints. Mechanical restraint means a physical device used to involuntarily restrict the movement of an individual or the movement or normal function of a portion of his or her body. Definitions continued. Physical restraint means the use of bodily physical force to involuntarily limit an individual's freedom of movement, except that physical restraint does not include the holding of a child by one adult for the purposes of calming or comforting the child. So physical restraint would be an example of holding someone down. Restraint means any method or device used to involuntarily limit freedom of movement, including but not limited to bodily physical force, such as holding someone down, mechanical devices, or chemicals. Restraint includes a chemical restraint, a mechanical restraint, a physical restraint, or seclusion. Seclusion means the placement of a person alone in a room for which egress is involuntarily prevented. So putting them in a room, locking a door, and seclusion wouldn't be used by Voyager. Restraints do what the restraint does not include. In compliance with industry standards adopted by national recognized accrediting bodies or the conditions of participation adopted for Medicare and Medicaid programs. The use of a protective device or adaptive device for providing physical support, prevention of injury, or voluntarily or life-saving medical procedures. So even though at one point something could be considered restraint, if it was voluntary by the patient or family, it wouldn't be considered restraint. Or if it was to provide physical support or prevention of injury, it could be in a situation where it's not considered restraint. The holding of an individual for less than 5 minutes by staff person for protection of the individual or other persons would not be considered a restraint, though this would not be a normal use of Voyager's personnel. If this was ever needed, you would want to contact Voyager leadership right away. Placement of an inpatient or resident in his or her own room for the night wouldn't be considered restraint. The use of time out as may be defined by written policies, rules, or procedures of a facility. We don't have timeouts at Voyager, and this is just a definition for other facilities. Restraints used while the facility is engaged in transporting a person from one facility or location to another facility or location when it is within the scope of the facility's powers and authority to affect such transportation, such as seatbelts. Basis used for restraints. Voyager may only use restraints, which in general we will never use restraints, but what's deemed by the rules and regulations of the state, restraints can be used in emergency situations after the failure of a less restrictive alternative, such as maybe being next to the client, trying to de-escalate the situation, or after a determination that such alternatives would be inappropriate or ineffective under the circumstances. Once again, this is your training so you understand the use of restraints within the Colorado law, but Voyager does not use restraints in general. However, the Director of Nursing may allow restraint use if demanded by a physician in an emergency situation, which care providers are trained. Once again, you will probably never see this while you work for Voyager because we have a no restraint policy. And if restraints ever were used, you would want to talk to leadership and the Director of Nursing right away so that you can make sure that this is something that's approved. Continued. A facility that uses restraints pursuant to the provisions of subsection shall use such restraint for the so why are we using this restraint? More basis for it. For the purpose of preventing the continuation or renewal of an emergency for the period of time necessary to accomplish its purpose. So you should never use a restraint longer than it's needed to calm down a patient, to get everyone to safety, until when the patient de-escalates. As soon as possible, you want to stop the restraint. In the case of a physical restraint, using no more force than necessary to limit the individual's freedom of movement. So restraint is only to stop the individual from being unsafe. You don't want to jump on top of them and inhibit their breathing when we're only trying to stop them from moving or hurting themselves or hurting others. So it's only what is needed and only for the time that it's needed. Once they calm down, restraints should be stopped. Or if you are not a nurse and you think they should be stopped, you should tell that to the nurse so that they can assess it. Duties relating to the use of restraint. A facility that uses restraints shall ensure that at least every 15 minutes, you or any staff shall monitor the individual held in mechanical restraints to assure that the individual is properly positioned, that the individual's blood circulation is not restricted, that the individual's airway is not obstructed, and that the individual's physical needs are met. So every 15 minutes we need to be checking on them thoroughly. No physical or mechanical restraints of an individual shall place excess pressure on the chest or back of the individual or inhibit or impede the individual's ability to breathe. So there have been many deaths with restraints, and that's why we have no restraint policy, where people maybe jumped on top of someone and they were trying to help the situation. They're trying to stop a person from hurting themselves or others, but because they were laying on their chest, an area that they thought would hold them down, they actually stopped them from breathing and people can die. Continued. Duties relating to the use of restraint. During physical restraint of an individual, an agent or employee of the facility shall check to ensure that the breathing of the individual in such physical restraint is not compromised. So we have to check the breathing. and we have to keep a very close eye on that with restraints, because that's one way that people do die with restraints. Voyager does not approve of chemical restraints. So even though there might be situations, very rare, you'll probably never see it since we have a no restraint policy, of a medical doctor demanding a restraint, and if the director of nursing approves it and we use it. However, Voyager will never approve the use of chemical restraints. Now, there could be a situation where a client's coming on and they have chemical restraints, or the medical doctor demands chemical restraints, but Voyager will actively advocate for the medical restraints to not be in use. So we may be trumped by a physician that isn't within the authority of Voyager, but we will continuously try anything we can to discontinue chemical restraints for lesser means. So, medications should never be used to restrain a client. It can be very dangerous. If you feel chemical restraints are being used, please notify Voyager leadership right away while referencing this video policy. This video may explain chemical restraints, but Voyager will never use chemical restraints. If chemical restraints are used, Voyager will advocate for a client until such restraints are no longer in use. So even more rare that we would ever use any type of restraint, it would be more rare for us to even think about using a chemical restraint. Once again, that would be a situation that maybe they came to us and had chemical restraints, but it would be our focus to get them off chemical restraints as soon as possible. Again, duties related to use of restraints. For individuals in mechanical restraints, facility staff shall provide relief periods, except when the individual is sleeping, of at least 10 minutes as often as every 2 hours. So we should be providing relief as often as 10 minutes, but no longer. We should be giving them some sort of relief and not allow mechanical restraints to be on an individual for any more than 2 hours without providing them that relief. So long as relief from the mechanical restraint is determined to be safe. During such relief periods, the staff shall ensure proper positioning of the individual and provide movements of limbs as necessary. In addition, during such relief periods, staff shall provide assistance for use of appropriate toileting methods as necessary. The individual's dignity and safety shall be maintained during relief periods. Staff shall note in the record of the individual being restrained the relief periods granted. So what this is saying is that even though they might have a restraint, and people might still say that they need to have that restraint, we need to give them relief. If they have arm restraints, if they have restraints on both their legs and both their arms, maybe because you don't want anything on them for longer than 2 hours, you take off one of the restraints in the arm and you let them move that around, then you put that restraint back on, and then you release another arm and then a foot. And you may do that individually or all together, or to allow them to go to the bathroom. And you may put those restraints back on, but you want to keep giving them as much relief as possible. And you can just imagine having a restraint on your arm, you win it for over 2 hours, how terrible that could possibly be. So relief periods from seclusion shall be provided for reasonable access to toilet facilities. And though we don't do restraints, we also don't do seclusions at Voyager. An individual in physical restraint shall be released from such restraint within 15 minutes after the initiation of physical restraint, except when precluded for safety reasons. So we want to release a person from restraints as quickly as possible. So once again, mechanical restraints would be something like you having restraints on the arms through actual vests and items. And physical restraints would be kind of holding down a patient through you physically holding down the patient. And so with physical restraints, you don't want it to be any longer than 15 minutes, unless it had to be for safety reasons. But once again, Voyager does not condone restraints at all, but this would be an increasingly emergent situation. Staff training. All agencies shall ensure that staff utilize restraint in facilities or programs are trained in the appropriate use of restraints, which is what we're doing right now. All agencies shall ensure that staff are trained to explain, where possible, the use of restraint to the individual who is to be restrained and to the individual's family if appropriate. So we really want to be able to let the individual who's being restrained and their family know why they're being restrained, because this can be a pretty chaotic and disturbing period of time, someone being restrained. Documentation requirements. Documentation requirements. Each facility shall ensure that an appropriate notation of the use of restraints is documented in the record of the individual restrained. Each facility shall document the following in the patient record: type of restraint and length of time in the restraint, identification of a staff involved in the initiation and application of the restraint, care provided while in the restraint, including monitoring, conducted, and relief periods granted, and the effect of the restraint on the individual. So, though Voyager does have a no restraint policy, like I said, in rare situations there could be restraints. But no, companion care workers, PCW, CNAs, they are not able to start a restraint ever. Not a mechanical, not physical, not seclusion. If there was ever an emergency situation where you thought that, hey, this is a crazy situation and could possibly need a restraint, only a nurse could ever initiate a restraint. And even nurses have to, even if they can initiate an emergency restraint. And this is in general, this isn't Voyager. Voyager will not use restraints. But in general, at another facility, a nurse may initiate a restraint as an emergency situation, but they very quickly have to get a doctor's order. And it really is best practice to try and get a doctor's order before you even initiate an emergency restraint. But once again, a companion care worker, PCW, CNA, they wouldn't be able to assess the situation by Colorado law to be able to start the restraint themselves, or seclusion, and of course chemicals they wouldn't be doing anyways. So even for a nurse, you would want to get a doctor's order within an hour, but immediately and hopefully before. But once again, Voyager does not provide restraints. We provide other therapeutic means to try and stop restraints from ever occurring. And we'll go over some of those pieces now. So why don't we use restraints when we are technically able to? And like I said, in a very rare situation and approved by the DON and very highly watched, we will, but really you should never see this. Well, there are many potential risks and side effects of restraint use. There are psychological, emotional risks, and there's increased agitation, hostility, aggression, and competitive. People feeling like they need to be in combat, or it can get to such aggression that they might actually physically try and hurt someone because it provides that much emotional distress. There's also feelings of humiliation, loss of dignity, increased confusion, and fear. There's physical possible side effects: pressure ulcers, skin trauma, tears, cuts, bruises, bone loss from decreased weight-bearing activity, decreased muscle mass, tone, strength, endurance. Deconditioning leads to stiffness, contractures, loss of balance, increased risk of falls, reduced heart and lung capacity, increased risk of orthostatic hypertension, and respiratory infections, physical discomfort, increased pain, increased constipation, increased risk of fecal impactation, increased incontinence and the risk for injury to urinary tract infections due to urinary stasis, non-movement, not going to the bathroom as much, obstructed and restricted circulations, reduced appetite, dehydration, and death. People have died from restraints. So, since Voyager has a no restraint policy, and you should really never see restraints used at Voyager, and even if you did, you should be talking to the director of nursing and leadership to make sure that not only are these allowed, that to see as soon as we can, like, how can we get this patient off restraints. Voyager has a no restraint policy, but we have an alternative policy. We will want to do anything we possibly can to avoid restraints. So which you can do certain things, such as you can offer certain things. You can provide diversional activities, especially with people with dementia. Let's say they're getting aggressive, you can try and show them pictures or talk or sing to them, or just create some sort of diversion instead of actually trying to hold them down. Decrease stimulus and noise. Provide change of positions, up the chair, ambulating the client. Maybe they're just uncomfortable and in pain, they don't know how to state it. Have patient wear glasses and or hearing aids. Maybe they're not understanding what's going on. You can activate a bed alarm if there's a patient who maybe gets up in the middle of the night, and it's not an aggression, but instead of using restraint, you can have a bed alarm to see if they're moving. One of the things that Voyager will do very often, if it's a aggression situation or non-aggression, just increase observation. Ask a family to sit with the patient, or our staff will sit with the patient. Alert other staff to be observant. Move patient to a room near the nurse, if possible, if there's a nurse available. If the patient is interfering with his or her medical equipment, that's another reason sometimes people use restraints. It's not that they're aggressive towards the care providers, but maybe they're trying to pull out their IVs. Maybe they're on so much medication at the time they don't know what's going on, or they don't want to have an IV in them, and we have to use a restraint, which Voyager wouldn't. But what you could do is educate frequently not to touch the treatment device. Sometimes they might just be a little out of it. You can place the device out of sight if possible. You can cover the device, wrap the device, hide it if possible. And though some people and agencies might use a restraint if they're trying to pull out their IV, we wouldn't. We would just have a care provider sitting right next to them and trying to hold their hand or anything we can to stop them from pulling out the IV, and thus you can stop the restraint from happening. Really, there is always like a 1% situation where restraint might be approved to use, but really 99% of the time, restraints honestly don't have to be used, and you can come up with alternative methods of trying to calm down the patient, trying to speak with them, teach them, get them back to understanding what's going on, prevent confusion. But even on that 1% time when restraints probably would be appropriate, you can still do things to avoid those restraints, such as having a care provider sitting next to them 24/7 and not leaving to get up unless another care provider comes. And that way you can stop them from pulling out their IVs or getting up, or other situations as well. So some important reminders. Document all alternatives that were tried before restraint use. The decision to use restraints must include the full awareness of the patient's rights, dignity, modesty, and well-being. Patients and families must be provided with information on restraints to allow for an informed decision. This should include providing them with information sheet using restraint safety. Also, we want patient and family education. Discuss with the patient and family safety concerns, i.e. risks of pulling out an IV. Explain the behavior that initiated the restraint use. Explain the alternatives tried. Assure that safety comfort will be met. Once again, even a restraint was used, which we won't from our company, unless I said under extreme emergency situations, what we're going to try and do the whole time is get them off that restraint as soon as possible, as soon as they calm down, as soon as something changes, as soon as the safety risk is gone, we want to get them out of that restraint. However, there are some examples where you might consider the situation as a restraint because it appears to be, but it is not. For instance, if certain restraints are allowed and they're not even considered restraint anymore if the family or patient decides. So if a patient is laying on a bed and they have side rails, and if it was against the patient's wishes, if we lifted those against their wishes, that would be considered restraint, right? Because it's preventing them from easily moving or getting out of bed. However, if the patient asked us, I would like those side rails up, that would no longer be a restraint because they want it. Or if a family member asked us who had medical power of attorney that they want the side rails up, then that would no longer be considered a restraint because it was family or patient approved. Another instance, if restraints are not considered restraint, restraints are only restraints when they prevent someone from being able to move when they have the ability to move. So for instance, if there was a wheelchair seatbelt on a patient, if that patient could normally get up on their own and walk from that wheelchair and they had a wheelchair seatbelt, it would be considered restraint. It wouldn't be considered restraint if the patient or family wanted that seatbelt just for extra protection and they gave us permission to do so. Then even though they could stand up on their own, and it technically is still immobilizing them to a point, it wouldn't be considered a restraint, but a safety use. But a CNA or caregiver or PCW couldn't just decide I want to put it on a seatbelt because it's safer. However, let's say a patient is in a wheelchair and they cannot get up, or they can't stand, or they can't walk, and really even if they scooted off they would fall, then a seatbelt actually would not be considered a restraint, because they cannot walk on their own, they cannot get up on their own, so that seatbelt is not stopping them from movement. The only thing that seatbelt is stopping them from is falling. So if a seatbelt is being used, for instance, on a patient that is unable to walk, is no longer considered a restraint, because it's just there for safety purposes and preventing a fall. And then what would even help more if the family, of course, agreed to it, or the patient agreed to it. And it's not considered restraint, because even though you can say, well, the patient could move, but in reality they can only kind of scoot up and fall down. Remember, in this educational video, it said that restraints are not considered restraint if it's preventing a patient from falling or from hurting themselves in that way. So once again, if the family or patient, family as in medical power of attorney, or the patient decides that they would like something that would otherwise be looked at as a restraint, we can allow that, but it has to be leadership, the director of nursing, the case manager in charge that you would talk to, so that they could put that in the case, because we would want to document that, maybe change up the care plan if needed. But once again, Voyager tends to have patients where they might be in a wheelchair and they're not able to just get up and walk on their own. And so a seatbelt, once again, would not be considered a restraint, because it's not preventing them from getting up and walking, because they're unable to do that. It's only preventing them from falling. And once again, Voyager would go and get the permission of the patient and or family, or at least speak with them on those matters. So this is summing up our restraint video. I hope you enjoyed that. Once again, Voyager has a no restraint policy. It would be an extremely rare situation and for us to ever have a restraint. And that situation would have to go through the director of nursing, and really the only situation that could occur is if another medical doctor came and stated they wanted that restraint, and we would advocate for the patient, or if a patient is coming to us from another facility and they're currently in a restraint, but we would act as soon as possible to take the patient off restraints. Thank you so much for your time, and I hope you have a wonderful day.